Hello, and welcome back to the official Indian Journal of Anesthesia podcast, where we'll be sharing insights from the editor's desk on the upcoming June issue. I'm your host, Dr. Gautam Reddy, and I'm thrilled to make my debut on this unique podcast. And joining me is Professor Dr. Rakesh Garg, the esteemed editor in chief of the Indian Journal of Anesthesia. Sir, I'm honored to be here and grateful for the opportunity to host.
Thank you, Dr.
So,
Gautam, and welcome to the brigade of IJA podcaster and young, enthusiastic, knowledgeable, and full of energy. People like you are definitely the lifeline of any organization.
thank you.
Welcome, Dr. Gautam.
Thank you so much, sir. Thank you so much. So happy to be on board. Without any further ado, I would just like to ask you, what are the exciting and the novel publications that we expect to see in the June issue? And would you be so kind to touch upon which of them would benefit anesthesiologists at, say, different stages in their career, be it postgraduates, clinicians, or researchers?
Absolutely. As usual, the Indian Journal of Anesthesia brings a diverse array of the manuscripts which are published into its issue. And since the scope of journal is related to anesthesiology, critical care, and pain medicine, so each issue has component from all these three specialty that we are talking about. And specifically, if we talk about June 2025 issue of the Indian Journal of Anesthesia, it has an array of studies, and the authors have nicely presented various innovative anesthetic techniques. They have included regional blocks into it, how they are affecting the outcome of the patient. The issue also includes manuscript where pharmacological interventions have been included to look for the current practice patterns in these patients, in this medical science practice. So this means the collective June 2025 issue aims to enhance patient care, optimize anesthetic management, or I will say the perioperative management. And also each issue, there is some highlight that what is the existing limitation of the existing knowledge. And this can be insight for the future researchers who are looking for future research, what is required. And specifically, this issue has 4 systematic reviews and meta-analysis on interesting topics. And when we say systematic review and meta-analysis, conglomeration of the published literature, some of them will give some conclusive evidence that this practice, this drug, this technique is beneficial. But some of them will have very focused area, a focus, you can say, primary outcome, and we will not be able to conclude anything on the secondary outcome. So it becomes food for thought that the future studies should highlight those aspects in which we still do not have a conclusive evidence. And that is what becomes important to do future research. Second aspect, when we talk about the whole issues, where is inclusive of an editorial for systematic review and meta-analysis, very interesting original articles, commentaries, and letter to editors. It also brings insight into that what is new that requires changing into a clinical practice. So as a clinician, we should remain abreast with the new information. And that is what we call as evidence-based medicine. So it will be something for them also to look for that which is a good drug. Say, for example, an interesting systematic review meta-analysis where the authors have tried to compare the existing published literature. They did a systematic review and meta-analysis of comparing phenylephrine, ephedrine, and norepinephrine in patients who are undergoing cesarean section. Though it's common, but here they have included those patients who are having preeclampsia. So this becomes a very important population wherein the risk of subarachnoid block induced hypotensions are always there, and we cannot compromise on hypotensive episodes in these patients, and that's where we have to use some pharmacological agents. And people have been using drugs like phenylephrine, ephedrine, or maybe norepinephrine also. So they have tried to compare these vasopressors that which appears to be an optimal one. And it has a direct clinical implication because we need to use the best drug. So I will suggest go ahead who are doing in obstetric practice, why not to look for this meta-analysis and come out that this is my drug which I will be using for majority of patients unless it's contraindicated. Similarly, when we talk about the cancer surgeries, in cancer surgeries, there have been little concern about the clinicians that the anesthetic management or perioperative care may have some impact on cancer recurrence. So I think we are providing anesthesia to get the patient cure of cancer. But if somebody says there was some hypothesis, some little evidences from the cohort studies or retrospective studies where they say certain anesthetic agents can cause the tumor recurrence. In those situations, we need a concrete evidence. And herein another systematic review where authors have talked about the impact of inhalation agents on the tumor metastasis, specifically in a cohort of the breast cancer patients. Interesting study, which agent and how they will be impacted, a good agent also. Similarly, we are also talking about um, uh, when we talk about the ERAS protocols and we say that the catheters and the cannulas and the tubes should be removed early so that the patient can be mobilized. And we have seen there is no additional risk if they are removed early in early post-operative period. So this is an updated systematic review and meta-analysis in which authors have examined the complication links to the early removal of urinary catheter, because we know that urinary catheters causes a lot of discomfort in the patients in the post-operative period. They have irritation, they can have increased chance of urinary tract infections and so on and so forth. And in RAS protocol, we want that it should be removed, patient should be mobilized, they should go and do the pass the urine appropriately rather than through the catheters. So this again is an important systematic review and meta-analysis where the authors have tried to systematically analyze it's an updated, in fact, updated systematic review where they have examined the complications linked to the early removal of urinary catheters in patients undergoing surgeries, and they're receiving epidural analgesia, and they're looking for the benefits and outcomes. Similarly, another meta-analysis where when we talk about the cardiac surgeries, sometimes we try to give them some pre-medications or pre-operative certain agents or perioperative certain agents. Here in author have looked for the L-carnitine supplementation because there is some literature where they say that it reduces the post-operative complications. So though we are providing the whole perioperative medicine or care to these patients who undergo cardiac surgery, but can we add certain agent which will reduce the complication? Because once the complication reduce, the outcome becomes better, the survival becomes better, the length of hospital stay become lesser. So they have used this agent L-carnitine to look for these effects. So these are the interesting systematic reviews and meta-analysis which has come up into the June issue. I will suggest strongly just go through them, and you will find that a lot of interesting things for each, for clinicians, for academicians, for researchers. Each you will find something into each systematic review so that they can go ahead.
Thank you,
And
sir. Yeah.
yeah,
No, I think yeah, what you briefly touched upon, I think there's some very exciting opportunities for future studies, especially I think in the field of obstetric anesthesia, like you mentioned, and also in onco anesthesia. It's very interesting to see that anesthesia drugs can cause recurrence in tumors. So I think that is something onco anesthetists can probably do further research on. So that's very exciting to see, and I'm looking forward to the new issue. So thank you
yeah.
so much. I appreciate you sharing the highlights of the new issue. It's
But
definitely got
I
me
will also
excited. Yeah, sorry.
I'm sure it will be excited for all the viewers of today's podcast. And we
Yes.
do have a lot of original articles also which are published in this
Yeah.
issue.
Yes, sir.
So when you talk of these original articles, those who are doing a lot of pulmonary interventions and providing anesthesia care, so we have an interesting study because while the rigid bronchoscope is being inserted for doing pulmonary interventions like coring, stent placement, biopsies, and so on and so forth, which should be the best strategy for ventilating these patients. We can have jet ventilation. We can, through the side port of the rigid bronchoscope, can ventilate through this, which is better. And once we have some equipment where we can see the lung infection, so when we get surgery done where there is a right bronchus mass and we want to see whether the lung has expanded or not. So this interesting study, VentiJet EIT study, talks about the comparison of two ventilation strategies. So this will be good for pulmonary medicine people and those anesthesiologists who are doing airway surgeries, the pulmonary intervention surgeries, again, a good option for them to look for. And similarly, we have another study where when we talk about the low flow anesthesia technique, we have to think of the overpressure wash-in method, or I can say that the strategies in which you can look for the safety of the induction of the inhalation agents during the low flow anesthesia. So what strategy to follow? A very another interesting study where the authors have looked for feasibility, safety, and efficiency of overpressure washing method using fresh gas flow half a liter with sevoflurane during the initiation of low flow anesthesia. And when we talk about the greenhouse effect now, we talk about uh, no, uh, conserving our inhalation agents, OT pollution. I think, but on simultaneously, we are also concerned that the patient gets right required amount of anesthetic agent. Another interesting study here. Similarly, when we talk about the pain management or the anesthetic management, certain drugs, which is like say lignocaine, they do have some effect on the reducing the requirement of opiates, requirement of the anesthetic agents, and we also have certain equipments or strategies to deliver them. So another important study where authors have tried to look for intravenous lignocaine infusion on propofol requirement using a closed loop anesthesia delivery system. Very interesting study coming from India. And lignocaine, intravenous lignocaine, which is preservative free, is being used. It has an opiate sparing effect. It decreases the requirement of inhalation agents or other anesthetic agents. And hence, and when we can give it through a controlled mode, it becomes very useful. So very interesting study which has been published in this issue. Another study, those who are working in neurosurgical aspects where the skull pin fixation is required, uh, we need to look for the right dose, because giving less dose or more dose, we do not know how much is the right dose. And another interesting study where authors have tried to find the 95% effective concentration of remifentanil. Now, since remifentanil is available in India also and people are using it, it's a switch on, switch off type of opiate. So, an interesting study where they have used and tried to find out which is the most suitable concentration of remifentanil for patients who require skull pin fixation, and they have tried to look effect using hemodynamics and surgical breath index monitoring. Surgical breath index is another important tool into our armamentarium, which are looking for the analgesic aspect. Another interesting study where the authors have tried to look for the effect of frailty. Now, we understand frailty is an important aspect. Those patients who are frail in preoperative period, they have lot of issues in the intraoperative and postoperative period. They may have increased complications, they may have increased length of hospital stay, they can have increased morbidities and complications. And here in this, another important aspect is when we talk about among these morbidities, one of the important is postoperative delirium and cognitive dysfunction, a very important parameter among the morbidities in postoperative period, especially in elderly patients. And this study again have talked about the association between preoperative frailty and postoperative delirium and cognitive dysfunctions in elderly patients who are undergoing surgeries under general anesthesia. Very interesting study. And this is a buzzword. So those who are listening to today's podcast, try to look for various aspects of frailty and its relation to various anesthetic drug, various anesthetic strategies, or its impact on various perioperative care that we provide to these patients, how they are related, and what we can do to reduce these patients in the form of prehabilitation in the preoperative period to reduce the frailty, and then look for how it impacts on the overall outcome of the patients. So I think this is important. And now it's the word of technology, the artificial intelligence, a buzzword now. So now, can we predict certain post-operative complications? And when we talk about the orthopedic surgeries, especially femur fracture, elderly patients, they will have a lot of issues. Delirium, I just mentioned. They will have other cardiac issues and so on and so forth. So this another study where they have modeled and tool using the artificial intelligence to predict the 30-day mortality on a data that they have collected. So I think this is important. If we can uh, choose those person who are at very high risk of mortality, we need to actively do something in pre-operative period so that we can reduce those complications, morbidity and mortality. So good tool which to look for. And another study which talks about the high frequency variability index monitoring and its relation with the vasoactive medication. An interesting study wherein they have tried to look for how these drugs have effect on the various hemodynamic parameters, and again this will have a good implication into a clinical practice. And then we have something into the commentary section also, where a modified costo-clavicle block, which those regional enthusiasts can find something new, and a very interesting commentary, in fact, which is actually a critical appraisal of IJA papers. So, as an editor chief, I do look for that those papers which has been published in IJA, how can we differently interpret them as a whole, or can we bring out some insight into those publications? So the authors have tried to critically appraise IJA itself, so that we can look for what new. And though the IJA has functioned very well in various components, and this the authors team has tried to look for the hypothesis reporting. Majority of papers have reported nicely hypothesis, but this is an important topic I would suggest everybody to go through who are researchers and who want to publish paper, that when you report your paper, your hypothesis should be clear. When you write your introduction section, we understand you mention lacuna of knowledge, you do mention aim, you do mention objectives, but also hypothesize, because many of the subsequent understanding or maybe even the statistical analysis will be based on what hypothesis or null hypothesis you have set for your study. So be very clear, report it into your publication in the introduction section, and it gives a good understanding by the readers also, that you have gone in the right track. So interesting paper. So I think a lot of papers, very good papers in the June issue as usual. And special thanks to all the authors who have submitted to the IJA their hard work. I know it must have taken 6 months, 1 year, 2 year to conduct a study. So special thanks to all the authors who have published their valuable work into the Indian Journal of Anesthesia.
Thank you, sir. So, thank you, sir, for touching upon each of the topics and highlighting each of those. And I'm sure, I think, because there's so much variety in this issue, ranging from every single aspect of anesthesia. So, it'll be very exciting for a lot of our listeners to dive into the new issue. So, I'm confident we can all gain valuable insights to improve our patient care and safety, and I'm eager to explore the issue further. So before we conclude, could you share the IJ's new exciting initiatives, as well as some information about the editorial and reviewer fellowships?
Absolutely. I think uh, I usually take a lot of medical education and adult teaching programs also to understand and to learn myself also, that how to teach others, how to learn further. And everybody of us has different modality of learning. Some people learn faster when they listen. Some people learn faster when they read. Some people learn faster when they learn the discussion about from the experts. Some people get better acquainted to the new information if they have interesting graphics or video graphics. So I was just thinking that how to bring about the IJA related information, the hard work of authors or the researchers to each person as per their need. And when we say in the medical science and as an academician researcher, we say patient centered outcomes are important. So as editor chief, it's also important for me that I should bring material which is reader centered. So all readers should get it what they want in the format they want. And that's where the IJA, with its whole team of IJA ambassadors, have taken new initiatives in various aspects. And that is what sometimes we learn by fun. And for them, it is the IJA quiz. Sometimes youngsters are very fond of, I could see, playing with the crosswords, walking, sitting in the train, in the flights. So it's the IJA crossword for them. Some people like that they want graphics. They may be busy person in their clinical practice. They want to update. They want that something should be in single page and graphical format. And it's IJA infographics for them. Some people believe that it's just not the infographics, it should come with some music and everything should come one by one. So it's IJA video graphics for them. Some people want it should be an discussion directly with the authors. And that's what the IJA podcast author. Some people want that, yes, authors have done their work, but why not editors speak something about it? They have little more experience. And here comes IJA podcast editors who are well renowned not only for academics and research, but they also have good experience editing the or giving reviewing the articles for various purpose. And this is what IJA podcast editor. In the beginning years, we have started the research and publications webinar, which was very popularly known as a REAP webinar, which also becomes popular. And this was on a Zoom platform, which was liked by everybody, and their videos are also available. We also started something called uh, you can say, the brief summary. And these brief summaries, people just want to, just listen the key points, the whole. This is something called one part of the journal club. So it's, you can say IJA Journal Club, or we have named it as IJA Video Vlogs, where one of our IJA ambassador will summarize just in 3-4 minutes in the form of a PowerPoint presentation about the whole aspect. And then we have snippets, which just highlights, because if somebody is in a cardiac anesthesia practice, somebody is in onco anesthesia, probably he will not like to see everything. So I just give them a snapshot that these are the articles, 15 articles, 20 articles published in this issue. I give them a flip book. Just turn around, find an important article which is suits you, your clinical practice, your requirement, and then go ahead and read it. And that's in the form of snapshot also. So I think these are the various options we have. And as you asked, we also want that people should take the leadership into the editorial process also. Many of the people are interested to contribute as reviewers, as editors. And I'm sure that once my tenure is finished up, more people should come and take up the editor chief post also, because it helps to disseminate the information to the global population in a better way. And that's why learning becomes also important. And when we have a good team of editorial board, I'm very proud of my editorial team, which are very dedicated, enthusiastic, and experienced. Why not to give that decades of experience which the cumulative editors have into the Indian Journal of Anesthesia to the budding editors or budding reviewers? And that's where comes up the editorial and reviewer fellowship. And we have labeled them as IJA editorial fellowships and IJA reviewer fellowship. And when we say these fellowships, the IJA reviewer fellowship is those who have experience in as an author, as a researcher, they have a little experience of publishing their manuscripts. They also need to contribute by reviewing the articles to provide nitty-gritties, because during their publication, they must have received the reviewers' remarks. It requires little understanding that on researcher side, we try to report what we understand about study. But as a reviewer, we have not done your study, somebody else has done it, and we have to comment upon. And that constructive feedback has to be given so that editor can take a decision and authors can also understand the limitations and try to improve upon. So this is what IJA Reviewer Fellowship of by the journal editorial board will help those to groom them up to become a good reviewer. And once somebody becomes a good reviewer, the next step is going up the ladder and then becomes the editors, editorial board member, editor, and then editor in chief. We also want to help them because uh, becoming editor is not a rocket science actually. It requires just basic learning, going up the ladder, and understanding the editorial process. And that's why we also want to make it transparent that nothing is behind the screen. We want people to see how the journal editors works, what they look for into the article, what they help, what they do to improve the article further, and how the integration between reviewers, authors, editorial boards, and editors, they come together to make an article which is worth publication. So this whole process again will be in the IJA editorial fellowship, which again will try to groom it over 1 year. This will primarily be an online based discussion on a digital platform, but they will be meeting it in the conferences. Especially one of the requirement is that they have to attend the National Indian Society of Anesthesiologists conference so that we can have meetings. But other meetings will be either on emails, on WhatsApp, but on Zoom meetings so that they can learn. And since the most of the editorial process is now digital based, so they can do various works on the digital. So this is again initiative. I think a lot of initiative for each our readers or enthusiasts who want to receive something, learn something from the hard work of authors, reviewers, and editors. So I think something is there in the plate for everything, and that is what I'm proud of the IJA editorial board. I'm proud of the IJA editors, including you, Gautam, and the whole team, which has contributed enormously. And at this platform, I put my gratitude and thanks to the whole team of Indian Journal of Anesthesia, along with the Indian Society of Anesthesiologists Governing Council. Everybody has come together to disseminate knowledge and information to everybody to improve our patient outcome.
So thank you very much, sir. This is, I think, having Indian Journal of Anesthesia up there amongst all the international journals is such exciting news for our country. And this whole thing has been very exciting news for, especially I think, the long-term listeners and readers of IJ, for making a lot of strides to deliver important studies in a very digestible form, like you mentioned. Like I am a visual learner, and I really enjoy the infographics, video graphics that IJ puts out, and also mentioning the fellowships. They're a great opportunity for anesthesiologists who are interested in conducting, reviewing, and like you said, also writing scientific papers. So very exciting times ahead, sir.
Thank you so
And sir, as we conclude today's episode, I would like to thank Dr. Rakesh Garg for his invaluable time and for sharing insights on not only the next episode, but also on IJ's new initiatives. And thank you to all the listeners for tuning in, and look out for the next episodes on the author's views and the editor's insights. Until then, stay curious and stay safe. I'm signing off. Thank you.